Evening to all. I am Dr. Asavri Sawant, Public Health Specialist for IHW Council, and I welcome you all to this exclusive hypertension awareness series, an initiative by Integrated Health and Wellbeing Council powered by Servier. According to the Indian National Family Health Survey 5 of 2019 and 2021, it is observed that 21% of women and 24% of men have hypertension. 39% of women and 49% of men in India aged 15 years and over are pre-hypertensive, and men aged 15 and above have higher prevalence of hypertension than in women. May is the National Health Awareness Month, recognized every year by the Government of India. May is also the May Measure Month, which is the global campaign by the International Society of Hypertension. Partnering up with Servier and joining the May Measure Month, Integrated Health and Wellbeing Council has organized a month-long initiative to raise awareness on the growing burden of hypertension and to make people aware on the different aspects around hypertension. That also includes other diseases that may get aggravated due to hypertension. In this live session, we will discuss on the topic of hypertension, which is a major complication for cardiovascular risk, obesity, diabetes, and kidney health. We have very eminent panelists here with us today. I welcome Dr. Anuj Maheshwari, who is the diabetologist and metabolic physician and professor in medicine of Hind Institute of Medical Sciences, Lucknow, and also the Secretary General for ISH. Sir, welcome to the show.
Thank you.
We also welcome Dr. Banshi Sabu, who is the president of All India Association for Advancing Research in Obesity and chairman for DIA-CARE, Diabetes Care and Hormone Clinic, Ahmedabad. Sir, welcome to the show.
Thank you.
We will also be joined by Dr. H.K. Chopra, who is the senior consultant cardiologist at Medanta Moolchand Heart Institute very shortly. And we would also be joined by Dr. Abhishek Raman, who is the associate consultant of nephrology at Medanta Hospital, Patna. So with that, and with a very expert panel here who are experts in their field, we would be evaluating how these different diseases are related with hypertension. We would be evaluating on obesity, diabetes, kidney health, and cardiovascular risk and its relation with hypertension. So as this is a platform to generate public health awareness, the audience is of mixed backgrounds, both medical and non-medical. So my first question is to Dr. Anuj Maheshwari. Sir, can you please highlight us how hypertension is related to diabetes and what is the mechanism behind it for people to understand?
Thank you, Dr. Asavri, for giving me this opportunity. And it's really my pleasure that I am on the screen with my brother, Dr. Banshi Sabu. So it's really a pleasure. Important thing is that hypertension and diabetes both are actually sharing the common roots. Both are sharing the common soil, and that soil is the insulin resistance. Insulin resistance, on one hand, we all know causes the diabetes because of its causing weight gain, it causing obesity. At the same time, it is also responsible for the type 2 diabetes. On the other hand, this is the mechanism which works with the hypertension because this involves the sympathetic nervous system to be exaggerated. At the same time, it is also responsible for the RAS activation. What is the RAS activation? This is a renal, angiotensin, and aldosterone system in our body, which is responsible for controlling the blood pressure and vascular mechanism in our body. And this insulin resistance stimulates these two things. In sympathetic nervous system, it rises the pulse, rises the heart rate, as well as it rises the all activities which are usually occurring in our body during the emergency time or during the time of the fighting. The body remains in the aggressive mode at the time. Once the sympathetic nervous system is overdrived or sympathetic nervous system is highly active. On the other hand, as I said, the RAS activation works with the insulin resistance. and insulin resistance stimulates it, and this RAS activation is responsible for retention of the water and sodium in our body. And when water and sodium starts retaining in our body, then obviously it causes the blood pressure high. And this high blood pressure is giving rise to multiple diseases as well as multiple complications, which we can talk in the further questions also. So this is the basic mechanism, but I try to make you understand so that it could be understood to the medical as well as non-medical people. How does the hypertension works?
Thank you so much, sir. We also wanted to know what is the prevalence of people specifically having both these diseases, hypertension as well as obesity, as both these diseases are lifestyle diseases and are on the very rise in our country. So, how many patients do we see that have both? And is it a common thing to see that somebody developing hypertension then developing obesity, or somebody who is already developing diabetes, or somebody who already has diabetes also developing hypertension? Is it very common?
This question is to me or Dr. Bansi?
Sir, to you only.
Thank you. A very good question this you have asked. Patients, those who are having the diabetes, they are having more chances of development of hypertension. As you have very rightly said about the prevalence in the general population, that is around 25% in the general population. But once there is a diabetes, then it may range between 32 to 82%. We have seen in some studies in which up to the 80% of the diabetic patients are also having hypertension. But on the other hand, all hypertensive don't become the diabetes. The ratio of hypertensive to become the diabetes is not that big as it is in the diabetes to become hypertensive. 7% or 6.9 or 7% hypertensive patient develops diabetes. So this is the relation between these two diseases when they are coming together. But always remember, if a person is having the high IR, if a person is having the obesity, if a person is having the type 2 diabetes, the chances of the development of the hypertension are very, very big and very, very high. Up to the 80% may develop it.
Thank you so much, sir. My next question is to Dr. Banshi. Sir, we have interacted previously as well on the same platform evaluating obesity. Can you please, to our audience, make us understand if the person is obese, how big is the risk for developing hypertension disease? Or if somebody is suffering from hypertension, how is that person more susceptible, if at all, to developing obesity? Are these two linked? And if so, what is the general prevalence that you see in your practice of obesity and hypertension both?
Thank you. First of all, thanks, Savri, for giving me the opportunity, and to IHW also. And my good friend Anuj is there. We both practice metabolic, where now it is no more like a diabetes. We practice dyslipidemia, obesity, hypertension, and all are interlinked. It is not like that one disease is there and other will not be there. Someone may have only hypertension, but tomorrow he may develop diabetes. Somebody may have diabetes today and tomorrow he may develop hypertension. It's like more or less a continuum. Now, your question primarily, which you asked for obesity and interlinked with obesity and hypertension. If you see, primarily the driver for all these problems starts with obesity. And it is not like in the adult age they develop obesity, rather I will say pediatric age obesity also started increasing. And that is the reason, same way the Anuj will agree that now even we are seeing the pediatric hypertension also in our country, which is also increasing, because normally pediatrician or even the adult physician, they don't measure the blood pressure for pediatric population. And that's become very, very common in our country too. Now, obesity is a reason for them to develop stress and inflammation, and that is the reason for them to have a hypertension too. The incidence of hypertension in an obese population. Now, again, in India, we may not see somebody is morbidly obese, but you will find the people with BMI of 25, 27, 28, 29, which have become almost like urban population, adult age population. I can see like 70, 80% of the people. But those who are sedentary, those who are in the office, you will find them obese people or overweight. But what is more challenging is we have central obesity. We have very typical of abdominal girth is increasing. Person may look lean and thin. His weight is also BMI may not be the right criteria to put them on obesity, but they have a central obesity. And the same way, the hypertension is also so common. And many times, even a person who is considering himself that my blood pressure was never high, last time I did, it was absolutely fine. And suddenly we measure that his blood pressure is not in grade 1, it is like grade 2 or grade 3. Blood pressure is high with 180 and 110 blood pressure type of thing. Now, in my clinical practice, we do measure even for a pediatric type 1 diabetic patients who are coming to our clinic. Also, for each and everyone, the blood pressure is measured. I am also part of one a big Rajpath club where we have 10,000 members, and we have make sure that each and every person who is coming to the club for regular activity, even there is a medical officer seeing the blood pressure for everyone if anybody wants to get it checked, and that is very common. We also find many of them are first time detected blood pressure patients. The problem is the acceptance level. Even they are detected first time when the blood pressure come 150 by 96, a doctor tells that your blood pressure is high. They don't accept it. No, it was not, or I was last time I was absolutely fine, or this is 2 days, my stress is the reason. People don't do in India is ambulatory blood pressure monitoring. They don't do the self-monitoring of blood pressure, which is also again with Anuj, we are doing nationally a campaign for people for self-monitoring of blood pressure. Rather, we are giving them blood pressure instrument at home and measuring the blood pressure in morning and evening. Even they might be on anti-hypertensive therapy too. So this type of social awareness and is very much required. Even those patients who are hypertensive and given them anti-hypertensive therapy. In my clinical practice, I have seen them, 1/3 of them are actually not under good control. So the target blood pressure is never coming under good control. And they keep on having, some or other excuse. Because today only my blood pressure is high because I'm having some stress. In last week, I was having some other issues. So obesity and hypertension is closely interlinked. In each and every person who is an adult, I feel that their blood pressure should be measured. I strongly recommend even to all our pediatrician colleagues and primary practitioners to measure the blood pressure even in younger population too. And all physicians, as we measure the blood pressure, but we should continuously to measure our patient blood pressure. And I strongly recommend people should self-monitor our blood pressure at their home because it is completely non-invasive. They have to just buy a one machine and they can do it at their home, and it does not cost them more. And ambulatory blood pressure monitoring is also required for some time for labile hypertensive, white coat hypertensive people, and sometimes those who are not accepting that they are hypertensive. But it is closely interlinked and it is completely a metabolic problem, which they may have dyslipidemia, hypertension, diabetes, obesity, central obesity, which all lead to cardiovascular disease or kidney problems. So these are the two major problems which we want to prevent.
Thank you so much, sir, for explaining us and everybody so in such a detailed manner. On the same note, we also wanted to know that detecting hypertension early is important and detecting obesity early is important. But there are many definitions to what an overweight or an obese person could be. So some studies suggest that weight was an age-old practice of measuring your body weight and then saying if you are above overweight level, you are obese. Some say that BMI is a better measure for measuring your obesity levels. And some say waist circumference is another good measure, and this should be prioritized. So, what should be the best method of knowing, as weight is a topic which varies from person to person? A healthy weight for one person may not be very healthy for another person. So, what should be the standard measure that people should follow, and how can we generate awareness to detect obesity early in our Indian culture as well? As our culture is very rich in food and tradition, and everywhere you go, you have very rich and delicious food everywhere. So, how can we know that this person is now becoming overweight or now on the verge of getting obese? What should be the proper protocol followed or advice given?
So, Asavri, very good question, because the awareness about the obesity is really poor. One thing that people don't understand, that obesity is a disease. First and foremost thing, American Medical Association before a few years, they strongly recommended now saying that obesity is a disease. In India, it is considered as a healthy condition. People don't call someone obese, even they call that now you are looking very healthy. It's not healthy, it's an unhealthy condition. Now, BMI is considered it as all practice to understand that BMI below 23 for India may be the ideal. 23 to 25, you may say borderline overweight, and then overweight, obesity. And again, this is Asian. Then in European, it is more than 25, we call them overweight, and more than 30, we call obese. What we found that we are centrally obese, which is again a thin fat Indian, a concept of that a person with abdominal girth, which is more, or a visceral fat, which is more insulin resistant and is metabolically unhealthy obesity. So that is the second more important thing which we could understand, that central obesity is a major challenge for us. Now, there are data and it is evidence-based that we now understand it is not only the obesity, it's the central obesity, which is a major challenge. Now, why it has been considered? You have seen few people who are very much muscular and doing gym exercise and doing very good, and their BMI may be even 28 and 30. And if you see their fat percentage, even in their body, it could be less than 15% or 20%. And even if you see their abdominal girth, which is absolutely fine, they may have a V shape and their BMI could be 30. So will you call them obese? You will call them metabolically healthy obesity. That's the condition which come out with they are metabolically healthy obese. So instead of that calling them obese and metabolically healthy obese, it has been considered we have to see everything. So person BMI, person weight, the person central obesity, which is waist circumference or abdominal girth, then what type of obesity? Is it apple shape or a pear shape? Because again, apple shape obesity and pear shape obesity also have more different risk for that. So it is where exactly the fat is deposited in your body that is also very, very important. And that is the reason we all classify in the different way. But what is the best way is, I always say a person should go to a metabolic physician to understand that I am becoming overweight or obese, my central obesity, what are the ways how I can reduce it, and how I can prevent myself from getting different complications, whether it's a diabetes or heart disease or NAFLD or kidney problem or hypertension. So, I mean, this is the best way, and more awareness is required in our country. We should not call people healthy, rather than we should call it obesity. But at the same time, language matters too. As a doctor, I can't say someone is a patient with obesity, because it's a person with high weight or increasing weight. That is the terms which we have to use. We can't, say somebody is obese, or we should not comment on someone's, person on their figure. So that is what is language really matters for that. And we normally do in our clinical practice, we explain the patient also. And some of the persons are really working very hard, but it becomes very difficult for them also to become, to reduce the weight. So there is one more terms which had come in US, if you know that, fit fat. So what is fit fat mean? A person may be obese and overweight, but still his fitness level is very high. It means what is his basal rate of heart rate, how much he can walk, how much he can do exercise, how much he can run, what is his cardiac, the stamina. So all these things also comes when it comes in picture, when we assess the person, what is his protein intake, what is muscle mass. So all these things also are very, very important. And when person comes with obesity, we assess all these aspects. We also try to understand that what is the cardiovascular risk, because they may have dyslipidemia, they may have hypertension. So, that is also to be controlled. And we try to prevent the complication in the person with obesity.
Thank you so much, sir, for so nicely explaining us. And as you rightly pointed out, these days language has been very highly, noted around obesity specifically, because many people suffer from body image disorders and other mental health issues. And we should not be labeling them as obese or overweight or commenting on the weight. But at the same time, it is important for society to recognize if somebody is going on the verge of becoming overweight or obese, or morbidly obese, then for their well-being, early detection of obesity and also other lifestyle disorders is important. On the same note, my next question is to Dr. Anuj. Sir, we spoke about early detection of hypertension. We also saw detecting diabetes early in a society where being healthy is glorified. But at the same time, detecting diabetes early is just as important, because underlying diabetes, the person might also be suffering from other lifestyle disorders. So going to the physician to get things checked is very important. So can you please touch upon what protocol should be followed for detecting diabetes and how to go about it?
Yes, very good question, Dr. Sabri. Uh, I believe that all patients, those who are gaining the weight, those who are getting obese, or those who are having the high blood pressure, or having the cardiovascular risk, or they are the first degree relative of the patient, those who are having the heart disease or diabetes, or they are first degree relative of the obesity, they should always check their diabetes status. They should always check their glycemic status, not only by simply by uh, going to the glucometer, not only simply by going to the one-time pathology, but the good thing is that they should check their status of the diabetes by consuming 75 gram of the anhydrous glucose, and after 2 hours of that, they should check their glucose level. If it is less than 140, they are fit and fine. They should not do anything. If it is between 140 to 200 or less than 200, they are in the insulin, they are in the pre-diabetes, or you can say that glucose overload. They should check their glucose intolerance, because they are getting the high amount of the glucose and they are getting not tolerated if they are in the glucose intolerance. And if it is 200 or more than that, then they should be labeled as type 2 diabetes. So both the patient, either they are in the glucose intolerance or they are in the type 2 diabetes, they should start practice the lifestyle modification immediately. And even after the 3 months practice of the lifestyle modification, they don't get appropriate control, they should start a medication. The people, those who are having the type 2 diabetes more than 200, their glycemic status is there, they should start a medication as well as lifestyle modification both together. And they should try to get more and more intensifying their lifestyle modification, like exercise, like walking, like doing maximum physical activity with diet management also. There should be always a diet management, not diet avoidance. Diet, we should not restrict any diet. Diet restriction, instead we should make it diet management, and we should try to get the appropriate calories more from the protein and fat instead of the carbohydrate to take care of the diabetes. And at one time, we should not consume more of the carbohydrate. Always remember that carbohydrate is not only injurious for the type 2 diabetes patient or type 1 diabetes patient, but it is also injurious for the hypertension. And apart from this, one more important thing we should keep remember, whenever a person gets detected of diabetes, 15 years before, the process of development of cardiac complications or vascular damage starts in his body with endothelial dysfunction. What is endothelial dysfunction? This is the inner layer of the blood vessel, and that inner layer of the blood vessel start disrupting about 10 to 15 years before the detection of the day of type 2 diabetes. So that's why we always try to catch them younger, and we always think that why this cutoff for the diabetes detection is coming down gradually every year. And this may be, people and think that this may be something fishy may be behind that. But this is actually an endeavor to catch them young or catch them earliest before they get the complication.
Thank you so much, Dr. Anuj. On the same note, my another question to you is, as we have seen, for measuring or labeling somebody as hypertensive, we need to check the blood pressure morning and evening for some duration, for a week, 2 week, or however the physician recommends. Is it the same with diabetes, or can diabetes be detected in one blood test? Can you please clear
No,
out for our
no,
audience?
definitely not. If you are going to check your diabetes status, at least three readings at three different times should be checked, and if they are all are found rising, then we should label a person having diabetes. diabetes or whatever the diabetes, type 1 or type 2 will be further matter of the investigation. And HbA1c is very important. If you are doing the uh, glycemia test of your patient and you are asking your patient to get it done, do ask him to get checked the HbA1c or when what happens many a time there are some medications, there are some drugs like steroid therapy which transiently raise the blood sugar level. And if it is because of that, some transient reason of that, then glycosylated hemoglobin or HbA1c will pick that kind of the patient. So it is always recommended to diagnose the patient with HbA1c or 75-gram glucose challenge and check it after the 2 hours.
Thank you so much, sir. So my next question is to both our doctors, Dr. Maheshwari and Dr. Sabu. So that as we have seen, some of the lifestyle disorders runs in family. They are being termed as that. That obesity runs in the family. Everybody in our family is obese. Or diabetes runs in the family and everybody is diabetic. Or hypertension runs in the family and every person in the family is hypertension. And for generations, this has been observed. So, can we speak on the long term effects, starting from you, Dr. Anuj, the long term effects of somebody suffering with diabetes and hypertension both? How can that damage person's quality of life as well as other physiological functions? Can you please touch upon that?
This is again very good question for the public point of view. And we see this much of the high prevalence of the diabetes and hypertension nowadays in our society. But if you remember 30 days before, 30 years before, if you go to 30 years before, then probably you will not find this much of the high prevalence in our society. 50 years before, the prevalence were further lesser. Why? What is the reason? What the changes has occurred which were not there at 30 years before or 40 years before or 50 years? The only thing is that the physical activity which we were doing, the level of the physical activity what we were having 30 years before or 40 years before or 50 years before, now we have reduced that level of the physical activity up to a larger extent. And we are really becoming so much of the dependent on luxuriousness and machine support or mechanical support in our day-to-day activity, may it be washing cloth, may it be utensils are clean, may it be our day-to-day activity like going office or whatever activity we are doing. So physical labor is becoming less and less. And that is the reason for upcoming of all these things. There is a very good slogan I have seen somewhere. Diabetes runs in the family, obesity runs in the family because no one runs in the family. So that is the reason because we don't do any physical activity because of what these diseases are getting more and more prevalent. And despite having all these diseases, if we add physical activity somewhere, I can say that many of the patients, those who are on a borderline diabetes today, they will become revert. Dr. Banshi Sabu is already working on the reversal of the diabetes. And he has launched that concept with the President of India of the reversal of the diabetes. And in that concept, it was there if we can ever reduce our physical inactivity, ever increase our physical activeness or exercise level, probably it will reduce the prevalence of type 2 diabetes, it will reduce the prevalence of obesity. At the other end, some of the things are more important, like late rising, like awakening up to the late night, keeping ourselves exposed up to the brighter light, up to the late extent of the night. And these are also the things which are acting on our insulin resistance, which usually shuts down after the 6 p.m. or 7 p.m. whenever the darkness comes. But we don't allow the darkness to come. We keeps on in the lights 24 hours almost or 16 or 20 hours in a day. Then we are not giving our body to take the rest. And that is another reason for which we are getting the insulin resistance higher and higher. And third is the diet. Our diet has also become one, we are all the time eating all the time eating. We have not kept our eating restricted to the time. Apart from that, we are eating very high calories food very frequently. 30 years, 50 years before, our countrymen were not having the enough food, and food was usually imported, and that was also in very lesser in amount, and that was also a very pathetic condition. No one would like to be in that position. But in such situation, we actually developed our body to have the storage of the calories in the form of the belly fat and all that. But nowadays, when we are having enough to eat, now we are having so much amount to have our food and all these things, then the the same activity and same develop what we have developed in our body, that is causing harm to us in the form of the obesity and developing the waist circumference higher and higher. Thank you.
Thank you so much, Dr. Maheshwari. Same question to Dr. Sabu as well. Sir, can you please touch upon the long-term implications of suffering from both obesity and hypertension? How can that deteriorate the quality of life that the person is living and can have other physiological damage in the body in the long term?
Shavri, can you just repeat the question? I'm really sorry.
Sir, we wanted to know what are the long-term implications of somebody suffering from hypertension and obesity, both physiological.
Hypertension and obesity both are the disease which can lead to, which can have the problem because of cardiology problem. That is the most common. So the hypertension is also a major reason for them to develop the kidney issue, but hypertension is also the reason for stroke. So what is seen in our clinical practice, the long-term consequences of the patient with an uncontrolled hypertension, stroke, cardiovascular disease, as well as the kidney issue is more. The person with obesity, we find more with the cardiovascular disease and more with the patient to develop the other cerebrovascular accident also. So the long-term complication we always explain, and many persons also understand that hypertension is one of the reasons for them to develop stroke. And this is commonly, patients and family also aware, because many the time when patient is early morning admitted with a stroke unit, and suddenly they say that, that guy had forgotten the medicine since last 5 days and 10 days, and he was not measuring the blood pressure. One more problem is the compliance. I have seen the many persons with blood pressure, even in your near dear relative, friends, doctor, colleagues, and many of them, they don't take it for 30 days. It means they are not exactly taking 30 days. If you just calculate that, last time when you purchased your bill, you show me, and you will find that 100 tablets written in that bill, and they are still after 125 days, they are showing that, yes, still I have 5 tablets more. It means in between, on an every week basis, alternatively, or someday or other day, they are missing. So these are the persons who really develop complication, because neither they self-monitor nor they take the regular medicine. The third issue is sometimes what happens, many persons with blood pressure, they keep on trying also stopping the medication. So suppose if I am on 1 tablet or 2 tablets, in between I will stop one medicine and I will go and get my blood pressure measured. The blood pressure may come on that particular day normal. So then they start feeling that my blood pressure is remain under good control even without taking medicine. And this they keep on doing. Suppose the doctor has written 2 medication, they will stop 1. If they are writing 1, they are making it half. In between they stop, they go to the doctor and get it checked. They may try alternative therapy also, that this medicine can reduce their blood pressure. So these are the persons they develop complication, and hypertension with obesity, particular to your question which you are asking, more with the cardiovascular disease which we see and the cerebrovascular disease.
Thank you so much. To both our speakers, there is another aspect that we wanted to touch, that is gestational diabetes and gestational obesity and its influence on the baby with hypertension. So we have seen if the mother is obese, suffering from obesity or hypertension, there is a high prevalence of the baby also developing this condition. So how can, how common is this? How alarming is this? And what can be done to prevent these? Starting with Dr. Anuj.
Yes, very good question. Another time. The important thing is that we always try to reduce the hypertension, reduce the diabetes, all those diseases which are arising out of the insulin resistance, all those diseases which are running in the families and are going from mother to the kids, as well as they can be transmitted from the one generation to the another generation, even from the father also. The important thing is that the atmosphere in which a child remains during the family, he enjoys that kind of the atmosphere throughout his life. And this is not established nowadays, but it has been long time back established, even the days of the Mahabharata. In the days of the Mahabharata, you must be remembering that story that Arjun has taught about how to come out of the Chakravyuh, and his wife slept that time, and that's why Abhimanyu could not learn how to come out of the Chakravyuh. So, although this is a story, but this is enough to understand that lot of things are there which impacts in utero life, which impacts if in utero hyperglycemia is there, it definitely impacts the child to become diabetic in the later life. And once a person is becoming diabetic, then the chances of the hypertension are also very high, because diabetes and hypertension are going together. Both are going from growing from the same roots. So if a person is becoming more prone to become diabetic in the later life, the same way the ladies, those who become pregnant and develop hyperglycemia during their pregnancy, they also become type 2 diabetic in their later life. About 35% females are found to become type 2 diabetic in their later life if they are having hyperglycemia in their pregnancy for one reason or another. Lot of changes happens during the pregnancy which are increasing the insulin resistance, and in pregnancy is the only condition where insulin resistance is welcome, so that a new body can be formed in the womb of the mother. And the dose IR is more than the requirement, then it gives rise to the type 2 diabetes, as well as it also puts the foundation of development of hypertension, not only in mother, but also in the forthcoming child. And then generation starts getting these kinds of the diseases.
Thank you so much, Dr. Maheshwari. Dr. Banshi, can you please highlight what preventive measures should be adopted so that a woman who is suffering from obesity or hypertension during the gestational time and does not, have their children also transmit these sort of diseases? As we have seen some studies that obese mother, there is a high chance of the baby also being obese. And
so
that
obese mother and obese pregnant lady particularly, they are at very high risk of developing many issues during the pregnancy. So I mean, now the complete concept is that Anuj is very active in a hyperglycemia and pregnancy group, that making people healthy more. So mother actually becoming pregnant, before that they don't plan that. The planning of baby should be also in advance. If somebody is overweight and obese, then before becoming pregnant they should try to reduce the weight. Look for all other things like metabolic profile of them. Sometimes they develop during pregnancy so much lipids high, and then you don't have any medication to reduce their lipids also. Similarly, we don't have now you can't do for reduction of their weight also, because she's already pregnant, and then they develop hypertension. They develop glucose, which is also high during the pregnancy also. And then this also, because these are the female who are obese, and then they develop a child which is a low birth weight child, and then this child who is going to develop in his or her adult life, again, all those complications too. So we have to create a awareness to become a healthy mom. So someone, a female who is today 12-year-old, we should start working for them only. They should be doing more exercise, taking more good protein amount of the food, right calorie balance. They should not become obese, not developing PCOS, vitamin B, vitamin B12. All things should be right. Their protein intake should be good. They should not increase in fat. Rather, they should increase in their muscle mass. And then they should have a normal, when they become mother at the age of 25 or 24 or 27, they should deliver the normal baby also. I mean, the risk of, otherwise what will happen? The cesarean section will be done. It will be premature child. The child will come also again with a low birth weight. And then again, this cycle will continue. So the obese female who are becoming pregnant, they develop a lot of complications. It is not just for the hypertension, the hyperuricemia, then preeclampsia, and eclampsia, and many other complications during the pregnancy also. So obesity is really a major challenge for them to become pregnant. Even to become pregnant also for an obese lady is also very difficult, I tell you. They have already infertility. High risk of infertility is there with obesity.
Even perinatal morbidity and
Yes,
mortalities are
also
very high in the obese female. So it's always required many of the time to the cesarean section if the lady is obese at the time of pregnancy.
just before 1 week only, Dr. Anuj Behri was a guest speaker in one of the world's biggest meeting of hyperglycemia in pregnancy, hypertension, and insulin resistance. I mean, he is one of the best from India who was there. They invited him as a faculty for that. And before that, he was there in US as an American College of Physicians, as a India chapter chair, as a governor, to give his talk in hypertension and this dyslipidemia.
Thank you so much.
Thank you, Basibhai, for the kind word.
No, we know, we feel proud for you on this.
Yes,
we
sir,
also
we sure
feel
do.
for you being a world leader in diabetes.
Thank you so much to both our dignitaries. We have Dr. Abhishek also joined us. Dr. Abhishek Raman is the Associate Consultant of Nephrology and Medanta Hospital in Patna. And we would like to ask him, sir, can you hear us? Dr. Abhishek, are you able to hear us, sir?
Yes, I can hear you.
Yes, okay. So, sir, we were evaluating today the different lifestyle disorders and their effects on hypertension, from cardiovascular risk to diabetes to obesity and to kidney health as well. So, we would like to know from you, how does hypertension affect kidney health overall? And if somebody is regularly hypertensive or has uncontrolled hypertension, how can that impact to his renal health, kidney health? Over to you.
Yeah, hi. So I wanted to, yes, hypertension is the second most common cause of kidney disease in all over the world, definitely in India also. And hypertension is also a disease that has been sometimes remained undiagnosed in people. And also sometimes, even though after being diagnosed, has not been is not treated optimally in many patients. Hypertension sometimes can be the cause of kidney disease. It is the second most common cause of kidney disease worldwide. But kidney disease can also cause hypertension. So it's like it goes both ways. Uh, yes, how hypertension can cause kidney disease? It's very simple. It affects the blood vessels and leads to decreased blood supply to the glomeruli and to the main working units of the kidney, which are the nephrons and the glomeruli. And in that way, can slowly decrease kidney function over time if it remains uncontrolled for prolonged periods. It is definitely once we diagnose a patient with hypertension, it must be controlled, and the targets that are provided kidney by our group, which is the KDIGO group. The KDIGO group specifies that patients who have both hypertension and kidney disease, the BP target, like in all other populations also. I'm just quoting the sprint trial. The target should be around 120 by 80, and in diabetic individuals, the target should be around 130 by 80. If we do not treat hypertension optimally, it will lead to faster progression of kidney disease, and the patient will land up in end-stage renal disease sooner than we would like them to.
Thank you so much, sir. I believe there is some network glitch at your end. We are not able to see your video. So if possible,
Yes.
Yes, yes. So, sir, another question that we wanted to know from you is how can early detection be done for somebody who is having kidney diseases and is is also having hypertension since some time? How can we make them more aware so that they are aware of the signs and symptoms for deteriorating kidney health? What the signs and symptoms would be so that the audience who is not from medical background is aware that okay, if I have hypertension for so many years and if I am seeing these sort of signs, I should go and get my kidneys checked.
Somebody who has had uncontrolled hypertension for a very long time, and now finally, patient is taking treatment for hypertension. The first, once you are diagnosed with hypertension, the patient should be evaluated for kidney disease at the same point of time. And when somebody is diagnosed with new onset hypertension, you must get a KFT done and see what your kidney function is like. No, because as I told you that it is not only hypertension that causes kidney disease. It's also kidney disease that can cause hypertension. So, and it is a secondary cause of hypertension. So we must rule out all secondary causes of hypertension, especially in individuals who are younger than 50 years of age. If somebody is diagnosed with hypertension, we must rule out secondary causes of hypertension, which includes kidney disease, also renal artery stenosis, and other diseases like pheochromocytoma. All the other causes. There are multiple causes of patients of hypertension in patients who are younger than 50. So once you're diagnosed, and once a patient is diagnosed not to have any kidney disease with a normal serum creatinine and no protein leakage in the urine, you can consider yourself to be lucky, and then you can uh, monitor the KFT, monitor the serum creatinine at regular intervals, probably 6 monthly or yearly intervals, and get a urine routine to watch for protein leakage. Usually we find the cases patients who are diabetic and hypertensive and sometimes deranged renal function. So in those patients, we have to start a particular class of antihypertensives which prevent progression of kidney disease, like ACE inhibitors, like telmisartan, and those drugs. So those patients should also get evaluated for what kind of drugs that they are taking, and yes, regular follow-up will keep the kidney disease away.
Thank you so much, sir. You also shared that there not the only does hypertension lead to kidney diseases, but kidney diseases also lead to hypertension. So,
Yes.
can you please highlight or elaborate on that for our audience to understand in simple languages?
So yes, the kidney diseases that lead to hypertension are first, diabetic kidney disease itself can lead to hypertension. Uh, this is this comes in the natural progression of diabetic kidney disease. That once it starts involving the kidneys, it can start affecting the regulatory mechanisms which control blood pressure, and they can lead to hypertension. There are other glomerular diseases, the most common being IgA nephropathy. If left undetected for long periods, can lead to hypertension. Otherwise, the other diseases that can lead are large vessel diseases like renal artery stenosis. So, especially in young females and older diabetic males, this disease can lead to narrowing of the renal arteries and can precipitate hypertension in such patients. What the benefit of getting a diagnosis of renal artery stenosis is that we can actually treat it by putting a stent in the renal artery, and that can lead to alleviation of hypertension. The hypertension can be cured, and the patient will not require any more drugs in such cases. If there are glomerular diseases that have caused hypertension, we can treat those glomerular diseases and then potentially treat the hypertension due to kidney disease.
Thank you so much for explaining that, sir. And as we understood, definitely there is a lot of need for people to be aware of both these things. That hypertension may lead to kidney diseases in future if not controlled, and kidney diseases also do lead to hypertension if you do not get them checked at the right time. So, what can be done to generate awareness? What are the tips that you would want to give to our audience who is watching, so that early detection of both hypertension and kidney diseases is possible if they see, or any sort of tips that you would want them to incorporate in their lifestyle so as to prevent these diseases for as long as possible?
So, see, because hypertension is predominantly a disease which does not have too many symptoms, and once the people who even have symptoms, the symptoms are very subtle. Uh, Usually, things like having some dizziness. We don't see that in all people having dizziness, having occipital headaches, which is like a headache at the back of the head. All these things might be causes. Might be seen in patients who have hypertension. So ideally, I think after a good thing would be to get yourself screened, to get your blood pressure checked at regular intervals. It's not very hard to do. It's not something that is very costly. So we can regularly screen the population for hypertension, and which would probably lead to uh, 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 more patients becoming aware of this disease, and we'll be able to catch more patients at an earlier stage and be able to prevent the deleterious the effects that hypertension itself has, both with respect to other cardiovascular diseases and with respect to kidney disease also. The if the I mean For some people with a higher risk for hypertension, like family history or history of smoking or tobacco intake, should definitely get themselves screened more. And once people start aging, you should definitely get yourself checked for hypertension, and then ensure that if you do find yourself to have a higher BP, uh, be more in touch with the doctors and check your home BP. Nowadays there are machines. These electronic machines can be bought and kept at home, and it has been proven that home blood pressure monitoring is a better marker of hypertension than BP monitoring in the office, doctor's office. So keep checking yourself at home, and that way we can prevent all the problems that are caused by hypertension.
Thank you so much, Dr. Raman. My next question is to Dr. Maheshwari. Sir, what would be your tips or advices for all the viewers that are watching to not just prevent diabetes but hypertension as well? What would you want to say to the viewers?
Yes, this month is dedicated for the hypertension management. This is called May Measurement Month of the Hypertension, dedicated by the International Society of Hypertension. Indian Society of Hypertension, for which I am representing, is also a part of the, or you can say, India wing of the International Society of Hypertension. And that's why we are following the programs which have been launched by the International Society of Hypertension. As Dr. Banshi Sabu has already said that May month has also been declared by as a overall health month. So in these circumstances, we must understand and we must try to make our public or our population understand that hypertension is one of the biggest killer. Even this is a bigger killer than diabetes. Diabetes prevalence in our population is 7.5%, which is established as of now. Maybe little more, but whatever the data which is available to us, that gives that 7.5%, 9%. But hypertension prevalence is 25%. So this is just 3 times of the diabetes population is having the hypertension. Both are having the similar kind of the risk. If you go into the complications, the similar complications can occur with the hypertension, what can occur with the diabetes. So we can have the stroke, as Dr. Banshi Sabu has already highlighted that cardiovascular diseases, but the things which has been left to be highlighted, like we can have the deafness, we can have the loss of the memory. Very few people understand this. They after 50 years they start forgetting the thing. After 50 years they start getting the deafness. After 50 years they start getting a lot of deficiency in their senses, and they develops small vessels neuropathy, and many times they don't know about that because they never check their blood pressure. So that's why this campaign has been started, especially for those who have never checked their blood pressure and not checked their blood pressure in the last 1 year. They should be checked for their blood pressure. And for this campaign, we shall be running this campaign throughout the month of the May, as well as it will be extended for 2, 3 more months if it is required. So we have given this task to all the members of the Indian Society of Hypertension, all the physicians, and all those who want to be involved in this campaign, that they should start checking of the blood pressure to those who are not known patient of the hypertension. Those who are known patient of the hypertension, they are requested to take care of their medication. They should also be checking their blood pressure time to time, so that they should know that whether their medication is working enough or not. So these things should be highlighted in this particular month. This month is dedicated for the hypertension management, which is going to be the biggest killer. One fact must be understood here. In India, 63% deaths are occurring because of the non-communicable disease. So still in India, although India is a country which is having the poor sanitization, which is having lot of infectious diseases, COVID and many other diseases are, we are having a poor population. We are having they are having lot of infections also, but still the infectious diseases are not the bigger killer in our country. In our country, the bigger killer are the non-communicable diseases, and they can be very well reduced up to the larger extent if we simply keep care of the hypertension. Even the mortality can be reduced in the diabetes patient, even if their diabetes is not so well controlled, but their hypertension is controlled, then can be reducing the morbidity and mortality of the patient. So my request to all those who are treating diabetes, or those who are not treating diabetes, all those who are treating any disease, at least they must check their patient's blood pressure once in whenever he is visiting your clinic. And all the patients are also requested to keep on checking their blood pressure. Now we are having the available that automated blood pressure instrument, in which there is no expertise is needed to check the blood pressure. You can take that automated blood pressure instrument and check your blood pressure easily, and you can know about your number. And that is the actual plan of the International Society.
Thank you so much, sir. That is some amazing work that you are doing and your organization, as our other specialists are doing as well. Thank you so much. We would like to end this session today. The session that highlighted hypertension as the major complication for cardiovascular risk, obesity, diabetes, and kidney health. Thank you so much for all our dignitaries for joining. Thank you, Dr. Anuj Maheshwari, Dr. Bansi Shabu, Dr. Abhishek Raman, for taking out time from your busy schedule and imparting us with a wealth of knowledge and information in this episode today. We hope the viewers also were, informed a lot in this session today. Thank you so much. With that, we would also like to thank our partner, Servier, for partnering up for the May Measure Month and for generating awareness on hypertension. Thank you. Lastly, we would like to thank our audience for staying with us till the very end. Thank you so much. With that, stay happy, stay healthy. Thank you.
Thank you.